Hi, I'm Jin-Xiong She. I'm an academic and research scientist for over 40 years. But today I want to talk about a very hot topic. That's NAD. So what's NAD? NAD is nicotinamide adenine dinucleotide. It's a vitamin that's essential to life because it's involved in the function of over 500 different enzymes. Basically, without NAD, there is no life. Unfortunately, NAD declines with age. As you can see on this slide, NAD level is high in young people. In the teenager group, over 75% of them have NAD levels above 40 micromolar. By our late 20s and early 30s, the NAD level is already reduced significantly. And in our 50s and beyond, the NAD level is only about 30 to 50% of the useful level. So without sufficient NAD, there are potentially many different health issues, including chronic fatigue or lack of energy, subpar performance, lack of mental clarity. You may have sleeping issues, and poor health in general, or major health problems like diabetes, cardiovascular disease, and many others. But NAD deficiency does not necessarily result in any visible signs. That's because it does take a significant amount of time for the NAD deficiency to result in major health issues. There are potentially a number of different ways to elevate NAD levels. Today, I really want to focus on one of the four major ways to elevate NAD levels. The first one is the intravenous infusion of the NAD plus molecule. IV NAD infusion has been a very old therapy for NAD. It's been used for decades, and it has been used for the treatment of various conditions, including neurological conditions, addictions, and some infectious diseases such as Lyme's disease and more recently post-COVID syndrome. It has also been attempted to boost energy in healthy individuals. More recently, there's been a big push to use NAD IV for anti-aging purposes. There are a number of limitations for NAD therapy, and the major ones include it's poorly tolerated by many individuals because of mild to severe side effects. The efficacy of NAD therapy is questionable. It may be useful, may be efficacious in some individuals, but may not be in many others. The benefits are potentially temporary and doesn't last very long, and it's a quite expensive procedure, and it takes a few hours to complete the procedure. So it's quite time consuming. The scientific effects on NAD IV are scarce, but here is a brief summary. So far, I have not seen any data, any published data that has evaluated the efficacy or safety of NAD IV therapy. But there are a lot of anecdotal evidence, and they are not very well summarized in any papers. As far as I know, I have talked to many clinical centers that are offering NAD IV, and I have talked to many customers who have used NAD/IV, and based on the information that I have gathered, NAD/IV therapy can be effective, can provide benefits to some patients with very specific conditions, such as neurological diseases, Parkinson's, Alzheimer's, and also addictions. And it has been used for treating Lyme's disease with some success. However, many of the benefits are temporary and does not last very long. And especially the use of NAD therapy to increase energy, the benefits have been shown in certain individuals, but usually it does not last very long, and the benefits disappear quite quickly. There's no evidence whatsoever that I can see for anti-aging purposes. There are still a number of key questions for NAD IV therapy, and the first one is really what are the mechanisms behind the intravenous IV infusion, and does it increase NAD levels inside of the cells, and what are responsible for the many side effects that have been seen in many of the individuals who receive IV therapy. And finally, is the IV NAD therapy right for me or for you? And I try to provide some answers to these questions here. Now, here is a clinical trial that we have conducted recently. We have 10 individuals healthy, and they have received a standard IV therapy protocol that consists of 5 sessions of IV infusion with 750 milligrams of NAD plus in each session. And these 5 sessions are spread over a time period of 10 days. As you can see on this slide, the baseline NAD level inside the cells that we measured using whole blood are represented in blue. So the blue bars are baseline NAD levels, and we also measured the NAD levels inside blood cells after 5 sessions, and the data are represented by the orange bars. So each individual here as a pair, you have the before and after IV therapy in blue and orange. You can see for each of the 10 individuals, the height of the blue bars and the orange bars don't differ for any of these 10 individuals, indicating that 5 sessions of NAD IV did not elevate NAD levels inside the cells. So this is the first clinical trial that has been conducted to demonstrate whether NAD IV therapy is effective in elevating NAD levels inside the cells. And the conclusion is very clear-cut. There is no evidence that NAD IV can increase cellular NAD. Then the question is, what might be responsible for the side effects that we have seen associated with NAD IV therapy? We have measured a number of biomarkers, and the surprise result is the significant increase of inflammation biomarker, the high sensitivity CRP protein. And this protein is increased by 3 to 10-fold in 70% of the subjects who have received NAD IV therapy. Is the increased CRP responsible for these side effects? We don't really know, but certainly we do not want CRP to be elevated by any procedure. And you normally would see a significant increase of CRP after surgery or after infection. So what's happening after NAD IV infusion is that our body and our liver considers the NAD infused as a substance that's not really beneficial to the body, and the liver is reacting to the NAD that's infused into our body. So even though this increase of CRP may be temporary and it lasts for a number of days and it does disappear over time, but we don't want our body to be subjected to this kind of shock. And this certainly is not a good thing to see. Now, since NAD IV does not increase intracellular NAD, and we have also seen some benefits, at least in some patients. So what's the mechanism behind the temporary relief after NAD IV therapy? Well, this is a question that I have been asked again and again. That's why I decided to address it here. This seemingly contradictory observation may be explained by the observation that we actually have NAD receptors on our neuronal cells and immune cells. So NAD plus can serve as a neurotransmitter and modify the neurological functions. And it can also serve as a ligand and transduce molecular signals inside of the cells, especially immune cells, to modulate our immune response. And also, the NAD infused into our blood is very quickly degrading into what we call NAD metabolites. And these are smaller molecules associated with NAD. And they include NMN, NR, or nicotinamide. So these NAD metabolites also have their own biological functions. So the potential benefits that are seen from NAD IV can be due to the signaling function of extracellular NAD or the functions associated with NAD metabolites. All right, so the next question I want to address is, what are the potential ways that are more effective at increasing NAD levels? And I don't want to spend a lot of time here today on this topic. We will make another video to dive into the details on this topic. But I do want to leave with you with the notion that we do have very effective ways to elevate NAD levels inside our cells as well as outside of the cells. The best strategy is to use NAD precursors. And on this slide, you see the data from patent pending formulation that we have developed. And as you can see, for the 10 subjects who have received NAD IV therapies and where their NAD level was not elevated by NAD IV, the oral supplementation with the NMN formulation significantly increased NAD level, and these are shown by the green bars. And each of the 10 individuals have the NAD levels significantly increased. 9 out of 10 individuals have their NAD levels optimized, meaning above 40 micromolar that are observed in very young individuals. Now, to summarize what I've talked about here today, and NAD IV therapy may be useful for certain individuals with very specific conditions, such as neurological and infectious diseases, and we'll know how effective it is may be person dependent. Secondly, NAD IV therapy, in my opinion, is not suitable for anti-aging purposes or performance purposes. And there are much better ways to elevate the NAD level, such as NAD precursors. And those strategies are much safer, much more effective, and much more affordable, and the effects are much more permanent as well. And at the end, I want to really emphasize that NAD optimization is really the essential first step towards optimize the health and health span. If you get your NAD optimized, most of you will see significant benefits. Thank you. And if you have any questions, please comment on the video and or contact us for more information.